Hello, welcome to Health Files. I am Neetu Grover. India has a massive shortage of doctors. Now imagine this, 60% of India's healthcare medical workforce caters to urban areas where 30% of our Indian population lives. That means we are left with the handful of medical professionals to cater to semi-urban areas and to rural areas where majority of our population lives. Now, this is not a new problem and it does not have one single solution. We need to understand this issue with the perspective of demography, education, religion and the policy of our country. But the truth is, we need more doctors, at least 6 lakhs more doctors. Now the question arises, what kind of doctors do we need? Do we only need MBBS of modern medicine or should we also educate homeopathic doctors, Ayurvedic doctors, Unani doctors or yoga practitioners? It's a very crucial question to ask because despite these alternative medical practices are recognized in our country, despite we have colleges producing homeopathic and Ayurvedic doctors with valid certificates, despite a lot of Indians going to these doctors for the basic treatments, the Indian Medical Association does not recognize these practices. Rather, a latest release by Indian Medical Association calls these medical practices as quackery. Quackery is unscientific. Quackery is dangerous. Now, for the common people, this sends a very confusing signals. In one hand, they don't have sufficient doctors. In the other hand, they are asked not to visit these doctors, especially at times the government approved healthcare centers, which might be their only resort. So what shall they do? That is what we are going to discuss today. Stay tuned.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
To discuss more on us and to have both the perspectives, we have two very special guests with us. We have Dr. Satish Tyagi, Principal Consultant, General Laparoscopic Surgeon, former Honorary State Secretary, Senior Vice President, Delhi Medical Association. We also have Dr. P. Rammanohar, Research Director of Amrita School of Ayurveda, who is also a Vaidya and researcher. We welcome you both doctors to this very special edition of our show. My first question is to Dr. Tyagi. Dr. Tyagi, yes. The Indian Medical Association has always distanced itself from Siddha medicinal practice, but it is only recently that they have gone against homeopathy and Ayurveda, also calling them quackery. Why this sudden change of stance?
See, it will not be right if you say that Indian Medical Association is against Ayurvedic or homeopathic practice. And see, there are different approach to the same problem. Now, it's a different pathy, it's a different science. My pathy is allopathy, which I studied for, say, 4.5 years as an MBBS, then as a specialist, 2-3 years, then practicing, then super specialization. So I know my field and I know whatever best available in this field and update my knowledge time to time. If I start prescribing medicines of homeopathy, which I don't have the knowledge of homeopathy or Ayurvedic, so I should not indulge unless until I also acquire the same qualification and expertise in that particular pathy. If I start doing allopathic practice and at the same time I practice Ayurvedic also, so I am a qualified person in allopathy, but I am a quack in homeopathy or Ayurveda. So it is not that we call one particular pathy as a quackery. No. It is the person who is not qualified for a particular practice and doing that. This is my viewpoint.
Right.
I,
Um,
I'm clear.
Right, doctor. So, Dr. Ram Manohar, what is your view? This is not for the first time that alternative medicines have been called out, but probably no one has called Ayurveda quackery before. What do you think? Why this sudden change of stance happened from Indian Medical Association?
I mean, it is very unfortunate that IMA has taken such a stance in the context of the incorporation of Ayurvedic, treatment protocol into the national guideline for managing COVID-19. I fully agree with Dr. Satish Tyagi that, in India, when we have a pluralistic medical healthcare system, practitioners of one medicine have their domain expertise. It is not correct for them to venture into another domain. That is definitely, not acceptable. In fact, many of us from the Ayurvedic community itself is working against this, what we call as cross-system practice. But here the concern is that this is not a system of cross-system, practice. What we have here with respect to COVID-19, it is only trying to incorporate Ayurvedic aspects of, treatment into the national guideline and empowering Ayurveda physicians to also offer care for COVID-19 patients. And this protocol has been developed not just by the Ayurvedic community, by a multidisciplinary, interdisciplinary task force, which consists of scientists and also modern medical doctors. And Ayurvedic physicians are only one part. So the best available evidence has been taken to formulate this protocol. And we know that when there is a demand for RCTs and high level of evidence, we know that this is not available even in modern medicine, because recently the WHO Solidarity trial revealed that none of the repurposed drugs are really having any efficacy. So in the situation of a pandemic, when we have to use all the available resources in the best possible way, this kind of a stance, dismissing the validity of an alternative system like Ayurveda and Ayush seems to be a little out of place.
Now the question arises, Dr. Tyagi, that India has a perennial shortage of doctors, especially in semi-urban and rural areas. A lot of people depend on alternative medicines as their only available option. In this scenario, IMA is pronouncing alternative medicines as quackery. Don't you think it will confuse the common people a lot?
See, when we talk on a TV show or when we talk in a AC room, it appears to be, yes, what you are saying is right. If we go to the ground reality, see, you move to the interior, you go to the rural area, see what kind of is going on there. If alternative medicine practice is being done, see, a Ayurvedacharya is prescribing medicines, he is using all his knowledge and skills, which has been defined in literature, which has been well documented evidence that yes, this pathy and this particular treatment for this kind of ailment is working fine. Yes, it is okay. But see what is happening at the ground level. See, a person who is not qualified in any of the pathy, he is just fifth class or may not be literate at all, and with a very primitive knowledge or without any knowledge, he is prescribing medicines without knowing the side effects of the medicines, without knowing any reaction occurs, how to manage, without knowing whether this will work or it will not work. So, what you will call this? There is no other name rather than quackery. Let me now I have opportunity to say mention a few things more. It is not that there is a shortage of doctor or the non-availability of the doctor. See, it is a system of failure because our civic agencies or our government is not able to provide proper working environment for the doctors. See, doctor is qualified with the evidence-based medicine. His practice is based, his diagnosis is based on investigations. His depends on certain support system. You know? But what is available at the village level or the rural area? Whatever he has learned in a medical college to practice, nothing will be available there. Not even the basic things are available. Then second question arises of uh, the kind of environment. Neither there is a drinkable water, nor there is electricity. See, how the vaccines will be stored. It will spoil. So many medicines which need to be stored at a particular temperature, they will be spoiled. At the same time, if you talk of the law and order area, or law and order, that also is not up to the mark.
Up to the
Those
mark. I understood, yeah. I
who know
understand.
it better.
Dr. Rammanohar, don't you think that a lot of questions arise because Ayurveda has not been able to prove itself properly yet? I mean, the concepts do sound very interesting. The 1,000 years old lineage sounds interesting, but the random claims and especially the unproven claims that we hear from Ayush practitioners about various things, do you think that has been a reason for lack of recognition, which Dr. Satish also just mentioned?
You know, Ayurveda was recognized as being part of our healthcare system since the time of independence. Of course, India was one of the few countries which proposed this pluralistic system of healthcare. But then, what have we done? I would also like to point out the ground realities in the field of Ayurveda. What have we done really to push research in the field of Ayurveda? Out of the total healthcare budget, this will for 3 or 4% is allocated for whole of Ayush systems. Within that, a fraction is available for research. So there is Ayurveda has always been dynamic. It's 5,000 years of continuity. I mean, of course, we don't know the exact years. It's always as you go far into the past that it is conjectural, but definitely more than 2,000, 3,000 years of continuous history and updation. But in the post-colonial period, we have not really taken up that aspect. It has just been lip service. You have a neglected sector where also the facilities are not available to do research. The modern scientific community, modern medical research community has to come forward. We have to
You can
own
pause.
up.
Yeah.
We have to own up Ayurveda as our tradition. There is just one more point I should mention. Like, there are great stalwarts in the field of modern medicine who have come forward. Like Professor M.S. Velliyathan initiated a science initiative in Ayurveda through the Prime Minister's office. And in the last 10 years, he did, path-breaking research on the so-called concepts of Ayurveda. And this has led to publications in high-impact journals. I was myself involved in the National Institutes of Health funded, USA funded study on rheumatoid arthritis with UCLA. So it is an irony that this funding had to come from the US to study traditional Ayurveda. Here we modified a research design. This research study led to a publication in Annals of Rheumatic Diseases, which is the highest impact factor journal in rheumatology. Our study won Excellence in Integrative Medicine Research Award from European Society of Integrative Medicine. So when we have really invested in research using proper methods, proper collaboration, the results have been interesting. If we don't do that, simply saying there is no evidence and not supporting research, I mean, this will not take us.
Especially, when Dr. Rammanohar, we say that Ayurveda is the mother of all the healings, and the literature is almost 1,000 years old. So definitely I agree with you. Now, Dr. Tyagi, calling out a health minister on their usage of Ayush is similar to calling out the education minister on how many government employees send their kids to government schools. So, calling a group of recognized or government approved set of medicinal practices as quackery is like, putting the entire country in a wrong light. Don't you think so?
As Dr. Ram said, and I do agree, Ayurveda is a old science and a 1,000 years of history. It is not a quackery, definitely not. But we have to see, rejuvenate this science because the literature has been lost. So many evidences has been lost, which used to be stored in your, say, old time universities like Nalanda or Takshila or that, because that all literature has been burned. Now, what we are practicing, see, what we see is a mixture of Ayurveda and the Ayush, uh, allopathy. Ayurveda Chara, if we practice the Ayurvedic totally, it's fine. But if the Ayurvedic person is using allopathic medicines without having a proper qualification in medicine, because the government or the political parties, they not only do their movements by, I'll say, there's something else also. If they're to evolve this science to help our old traditions and old chikitsa paddhati, I'll say, then they should increase their share of GDP to the health sector. See, it is less than so many neighbor, even the Bangladesh is spending more money on their health than India. Why it should not be 10% of our GDP, which should be invested in the health sector? If you invest that much of money and Ayurvedic science is evolved with it, they should create exclusively Ayurvedic institutes which will do research on all the medicines or all the treatments, ailments, whatever literature available, they will enrich it. Then, yes, it should be. If just for a showcase or then I think it is, we cannot support that.
Dr. Rammanohar, do you think that is there a lack of unity or a lack of collaboration from the alternative medicinal practitioners where they have not been able to work together or haven't been able to reach out to their peers of modern medicines and work with them?
It all depends on how we have nurtured our pluralistic healthcare system. In India, we have a model of opposition. Although we legally sanction different medical systems, there is no healthy environment where systems are, cooperating and working with each other. I know a lot of Ayurvedic practitioners and allopathic practitioners are able to collaborate on individual level, but the system doesn't encourage it. So unless there is that a model of healthcare where there is mutual respect and a value for collaboration, this cannot move forward. Right now, it is mostly like preserving your professional territories. It's a war of professional territory. So that is what is, I'm very much against this cross system practice. I've been very much voicing my views against that we should have core competence in our own domain. But what right now, since we are talking about the IMA stance, that is what surprises me. Because this time the Prime Minister definitely came up with a very clear mandate that no false claims should come from the Ayush systems. Ayush practitioners should not, do modern medical practice. They should stick to their own domain. And that is why the interdisciplinary task force was constituted to vet a treatment protocol by scientists and doctors. So here we don't have a system. In the COVID situation, at least, it's only a question of Ayurveda doctors being given a space where it is relevant, based on examination of best available evidence on in what way we can give supportive care. In many cities, I know my colleagues have been treating COVID-19 patients. In Kerala, we are still not allowed. Many of them have not even getting entry into an allopathic hospital. They are sometimes dying outside. So in such a situation, totally denying, other systems to even play any role. That is what is, matter of concern.
Dr. Tyagi, do you think that Indian Medical Association is qualified enough to understand, validate, or recognize a set of medicinal practices which is distinctive and very different from their own, or is it just a show of power?
No, I disagree. It is it is not, means IMA not is a authority or not is a institute which will define whether a particular pathy is the right or wrong. See, uh, as Dr. Ram also saying, see, when you do evidence-based practice, when you have enough, yes, this particular medicine, whether it is Ayurvedic or allopathic or homeopathic, is is results are reproducible, its results are predictable, and it gives similar kind of results whenever it is used. See, then it creates a level of confidence in the person who is prescribing it, and at the same time, you see confidence in other pathies and other person or the public or the patient. Yes, whatever treatment I am getting, I am going to have this kind of predictable results. See, this will not come overnight. During this pandemic, say there's a COVID, this virus is very illy, means initial knowledge about this virus was very little. And even the modern science, the allopathy was not having much of its predictability and was not sure of what kind of treatment is to be given. It was all hit and trial treatment, or whatever knowledge we have, we collectively used it to treat this pandemic. The same other pathies also could have tried. They should have also seen their literature. They've seen the past evidence that this kind of illness, this particular medicines of Ayurveda or allopathy or homeopathy, it works. And if it means the double blind, I'll say trials have been, they should have taken a permission from ICMR to do the research work on this particular medicine. Yes, we want to do the research. They should very well, they should conduct the research. And of course, if they can find a better treatment, if they can give better results, why not?
Why not? True, very true, doctor. So, Dr.
I,
Rammanohar, do you think that IMA is
IMA is
discrediting
not
Ayurveda and that
going
hurts the
to
brand
any of the
image?
I just like to add here. I think affecting the brand image is one thing. I mean, really putting the whole healthcare system into jeopardy is what is really, of a matter of concern when you make sweeping statements like this. Because what Sir has said now is exactly what the Ayurvedic community has done. The interdisciplinary committee created provisions to submit research proposals. And we can see that the AYUSH clinical trials and studies outnumber the number of trials registered in the CTR. More research initiative has happened from the AYUSH community this time. So exactly we are trying to follow that method. Literature review have been done. We have tried to present. I have myself been involved in one of the first papers to profile COVID-19 from an Ayurvedic perspective and talk about what are the possibilities. So, and also two things are here. Evidence is definitely needed. I'm fully in agreement with, Tyagi sir.
Dr. Tyagi.
Because yes, Dr. Tyagi, because in our own tradition, we have said that Ayurveda was one of the earliest systems to distinguish between chance effect and real effect of medicine. Charaka Samhita clearly says just because you give medicine to a patient and he gets better does not mean that it's your medicine that worked. So we need to build evidence. But there is also a big debate as to what is the right kind of research method that is needed. RCTs are not always possible. So it is very, very important for us to understand that we need to explore alternative research methodologies like mixed methods, whole systems research. So this is a problem.
Like what Dr. Rammanohar is saying, Dr. Tyagi, what will you advise? No alternative medicines or alternative medicines only in certain conditions, keeping in mind that, a lot of people in India do not have access to modern medicines or doctors.
I personally feel this Ayurveda will be a big help to our large number of population who is in rural, urban population. And we have, it is already there, but we have to see re-evolve it. और say we just कहते हैं ना जैसे बुक रखी हुई है रैक में भी हमें निकाल के उसको पढ़ना है, हमें उसे निकाल, तो उन चीजों को हमें दोबारा से उनको लाना, ये ओवरनाइट नहीं हो पाएगा, टाइम लगेगा, इट विल टेक, पर डेफिनेटली इज इट डिफरेंट सिस्टम देन एलोपैथी, बट I will not say it is not effective system. It's a still effective system, but should be properly bring back. And as far as allopathy is concerned, allopathy over say last 100 years or 200 years, it is a continuous process of evolving. You know? At the same time, Ayurveda has taken a back seat because there was no research done in last say 100 years or 200 years. So yes, it's our Indian system, and we should value our Indian traditions and Indian system of medicine also. But we need to work a lot. And I agree with Dr. Ram. Yes, if we join hand, see, allopathy and Ayurveda join hand, we can bring a better system of medicine. There are certain things which, see, if you go for emergency surgeries, which I am a surgeon, so most my focus is on the surgical treatment, and in emergency, no replacement of that. It's a life. But too many chronic ailments or lifestyle diseases, Ayurveda is very, very effective, and it can be a say big change, and it can the society a better option. So, if combine hand, join hand, I think we can give a better system of medicine to our country, but we have to be friendly.
Dr. Rammanohar, what will be your advice? Like, till what point should a person be dependent on alternative medicines before moving to modern medicines? Should they look at alternative medicines as a support function, stopgap arrangement when they don't have access to modern medicine? Or can that be their primary healthcare option? What do you think?
I like to just recall what Professor Bhushan Patwardhan, the vice chairman of UGC and member of task force and Niti Aayog Integrative Medicine Initiative mentioned, that it is time we moved from a pati-based approach to a people-centered approach. Here, it's not a question of which system is superior or which professional is. Every system has its merits, and as Dr. Tyagi rightly mentioned, modern medicine has been developing, in leaps and strides due to the research, initiatives. So we have to get the best that is available for the people. So unless our attention shifts from conflict of medical systems to what will benefit the patient, the person, that we will not be able to move forward. And that differs from situation to situation. We have to study that. At this point of time, we do not know. Which system will be helpful. I feel all four possibilities are there. In some diseases, modern medicine will be the frontline treatment. In some other diseases, it is better to try Ayurveda first before going to modern medicine. In some diseases, Ayurveda can be the main treatment and modern medicine can be supportive. We are struggling. Sometimes if there was a modern support, we could have given better outcomes to a patient. And in some other cases, when modern medicine is doing the leading care, Ayurveda can also give a supportive care. So in India, since multiple approaches are there, it is high time we all came together rather than, throwing mud at each other. Shift from systems to patient and then evolve an integrative approach. And I think the Niti Aayog is really taking a major initiative in this direction. And I hope all these conflicts will resolve when we move forward with this mission.
So now, after a discussion with you, Dr. Satish Tyagi, and with you, Dr. P. Rammanohar, what I am able to comprehend is that, keeping in mind the complexity of modern day diseases, the comparatively unregulated nature of alternative medicines in India, there should be a pragmatic plan. IMA should look at the issue from the public welfare point of view and should work with Ayurveda and homeopathy practitioners to reach a common point. At the same, besides being based on individual subjective experiences, the alternative medical services should provide the evidence in public domain for scientific scrutiny. So thank you so very much, Dr. Satish Tyagi and Dr. P. Rammanohar, for giving us a perspective from both the sides and for enlightening us with your in-depth knowledge. Thank you so much. This doesn't look like a debate to be ending soon. But for the sake of common people, we hope that this ends soon. And we get clear directions based on research and facts, and it is not left to our personal bias, assumptions, random claims, and most importantly, compulsions. Goodbye till we meet in our next episode next week. Stay healthy, live life. Thank you.